If you're 35 weeks pregnant, take a deep breath with me. You are in the final stretch of the 8th month. Your body feels heavier, sleep is harder, emotions may be stronger, and maybe part of you is thinking, is this normal? Am I ready? What if something happened? Let me gently tell you this. What you're feeling right now is not a sign that something is wrong. It's a sign that your body is prepared. Your baby is growing beautifully. Your body is adjusting in powerful ways. And even the discomforts, the pressure, the frequent bathroom trips, the emotional waves, they all have meaning. In today's video, I'm going to walk you through exactly what's happening with your body, what's happening with your baby at 35 weeks, what exams you need now, how to manage anxiety, what to expect from labor, and how to feel more confident and informed as birth approaches. Because fear usually comes from not knowing. And when you understand what's happening, everything feels lighter. Before we begin, take 1 second to support this channel. Subscribe so you don't miss the final weeks of this journey. And like this video, it truly helps other moms find reliable, calming information just like you're looking for today. Now, let's talk about you, your baby, and this beautiful, powerful stage you're in. At 35 weeks pregnant, it can feel like your body has reached its limit. Your belly is heavy, movements are slower, and simple tasks require effort. But what may feel like too much is actually a sign of precise biological preparation. Your body is not breaking down. It is adapting in highly intelligent ways. Your uterus has expanded dramatically and now sits approximately 15 centimeters above your belly button. That stretching sensation, that tightening, that pressure under your ribs, these are reflections of growth. The space inside your abdomen has been reorganized to prioritize your baby. Because your baby is larger and stronger, movements may feel different. Instead of flips and rolls, you may feel stretches, pushes, and firm pressure. This does not mean movement has stopped. It simply means space is limited. Everything about this stage signals readiness. Your body knows what it is doing, even when it feels uncomfortable. You may notice your belly looks lower than it did a few weeks ago. This can be a sign that your baby has moved into a head-down position and begun engaging in the pelvis. This is often called lightening. When this happens, breathing can actually feel easier. Many women report less heartburn and less pressure on the stomach. That sense of relief in your chest is not imaginary, it's anatomical. However, as baby descends, bladder pressure increases, frequent urination becomes more intense. This is not regression, it is redirection. Your baby is positioning for birth. Your body is cooperating beautifully. Sleep at 35 weeks can feel frustrating. Between bladder trips, hip discomfort, and finding a comfortable position, rest may feel interrupted. This does not mean your body is failing. It means your system is working around the clock. Hormones are preparing your ligaments and joints to become more flexible. That looseness can cause pelvic or lower back discomfort, especially at night. Using pillows between your knees, behind your back, and under your belly can reduce strain. Small adjustments can create meaningful. Your body is not fragile, it is transitioning. You may also notice increased pelvic pressure or a sensation that your baby is very low. This can feel intense, especially when walking. As the baby engages, the cervix gradually begins softening. This does not necessarily mean labor is starting. It means preparation is underway. Many first-time mothers worry that every pressure sensation means immediate labor. In reality, the body prepares gradually over days or even weeks. Preparation is not emergent, it is progress. You might feel your baby's movements more distinctly against your abdominal wall. Some women can even recognize a foot or elbow pressing outward. Because the uterine wall is thinner now, movements can feel stronger, even if less frequent in pattern. These defined movements are signs of strength. Your baby has developed muscle tone and coordination. Your body and your baby are communicating constantly. Back pain is extremely common now. As your baby gains weight, often about 600 grams in just 2 weeks, your center of gravity shifts forward. Your lower back compensates for that shift. Muscles that were never designed to hold this much forward weight are now working overtime. Gentle stretching, warm showers, and supportive belts can provide relief. Pain in this context reflects adaptation, not injury. If you are carrying twins or more, your preparation timeline may be accelerated. Many multiple pregnancies deliver between 34 and 37 weeks. This means organization becomes essential now. Hospital bags, documents, and support plans should be ready. Increased discomfort does not mean danger. It reflects the extra demand on your body. Your strength is extraordinary. You may notice visible pulsation in your abdomen when lying on your back. This is due to increased blood flow to the uterus and placenta. Your cardiovascular system is working harder than ever, pumping significant blood volume to sustain your baby. That pounding sensation is circulation, not malfunction. Your heart is supporting 2 lives right now. Emotional fluctuations may intensify. Anxiety, tears, impatience, all can surface quickly. Hormones such as estrogen and progesterone are at peak levels. They influence mood regulation and sensitivity. When overwhelmed, pause and breathe deeply. Stretch your arms upward and reconnect with your breath rhythm. Calm can be practiced even in small. Most importantly, at 35 weeks, discomfort does not equal failure. It equals transformation. Your body has expanded, softened, shifted, strengthened, and adjusted in ways that are biologically remarkable. You are not behind. You are not weak. You are in transition, and transition's powerful. At this stage, bladder control may feel unpredictable. The growing uterus places significant pressure on the bladder, reducing its capacity. Even small amounts of urine can create urgency. This is common and temporary. Stress incontinence, small leakage when coughing or laughing, is normal late in pregnancy. It does not mean something is wrong. However, one concern many mothers have is distinguishing urine from amniotic fluid. Amniotic fluid typically has a mild, slightly sweet, or bleach-like scent. Urine has a stronger, more acidic odor. Fluid from ruptured membranes is often continuous, rather than occurring only with pressure. When uncertain, observation helps, but medical confirmation brings. If your water breaks, it does not always mean labor begins immediately. Some women experience contractions hours later. The body can rupture membranes as part of preparation, not necessarily immediate delivery. Calm observation. If fluid leakage is persistent, clear, and not associated with coughing or movement, contact your provider. At 35 weeks, rupture of membranes requires evaluation. Even if everything is fine, reassurance matters. You deserve clarity, not doubt. Do not feel embarrassed seeking care. Healthcare teams expect these questions. It is always better to check and be told everything is fine than to stay home uncertain. Medical reassurance reduces anxiety dramatically. Peace of mind supports both mother and baby. Temporary urinary leakage after standing up is common because of sudden pressure. When you rise, gravity increases downward force on the bladder. This mechanical response explains much of late pregnancy. It is physics, not failure. Pelvic floor exercises can help maintain muscle tone even late in pregnancy. Gentle Kegel exercises improve bladder support. While they may not eliminate leakage entirely, they strengthen recovery postpartum. Small actions now support healing later. If membranes rupture, your care team may monitor baby's heart rate and infection marker. Prompt assessment protects your baby. Most cases are managed safely and calmly. Information replaces. It is important to remember that your body gives signal. Changes in fluid, smell, or pattern are data, not panic. You are not expected to diagnose yourself. You are expected to seek support when unsure. At 35 weeks, vigilance is not anxiety, it is wisdom. Trust your observation, trust your instinct, trust your care team. There is no prize for waiting in uncertainty. Peace of mind is part of prenatal care. If you are pregnant with twins, triplets, or more, reaching 35 weeks is a remarkable milestone. Multiple pregnancies often follow a slightly different timeline, and many births occur between 34 and 37 weeks. This does not mean something is wrong. It means your body has been working at an even higher capacity from the very beginning. Carrying more than one baby increases uterine stretching, blood volume demands, and metabolic requirements. Reaching this point is an achievement worth recognizing. Physically, discomfort may feel amplified. The uterus expands more rapidly and to a greater degree in multiple pregnancies. You may experience stronger pelvic pressure, more pronounced back pain, and increased shortness of breath. These sensations reflect space limiting and not necessarily complicated. Your body is accommodating more than one growing human because multiples tend to arrive earlier. Preparation becomes essential now. Hospital bags should be ready. Test results should be organized. Transportation plans should be clear. Having everything prepared reduces anxiety significantly. Organization creates emotional stability in the final weeks. Emotionally, you may feel both excitement and heightened concern. Statistics about earlier delivery can feel intimidating, but most babies born between 34 and 37 weeks do very well with appropriate care. Neonatal teams are trained specifically for these situations. Preparation replaces fear with confidence. Monitoring in multiple pregnancies is often more frequent. You may have additional ultrasounds to assess growth, fluid levels, and placental function. This increased surveillance is protective, not alarming. It ensures each baby is developing safely. Energy levels may be significantly lower now. Your cardiovascular system is sustaining multiple placental circulations simultaneously. Fatigue is not weakness, it is physiological demand. Rest becomes not just helpful, but necessary. If contractions begin earlier than expected, it does not automatically mean emergency. Preterm contractions can sometimes be monitored and managed. Medical teams assess cervical changes and fetal well-being before making decisions. Calm evaluation guides safe outcome. Nutritional needs are often higher with multiple. Adequate protein, hydration, and iron intake become especially important. Your body is distributing nutrients between more than one developing brain and body. Every balanced meal supports more than one heartbeat. You may also experience stronger emotional swings. Hormonal shifts combined with physical intensity can feel overwhelming. It is completely valid to feel both gratitude and exhaustion at the same time. Both emotions can coexist without canceling each other. If you are carrying multiple, understand this. You are already at the finish line. Whether delivery happens this week or in 2 weeks, your preparation matters more than perfection. Your body has done something extraordinary, and your babies are benefiting from every single day you carry them. At 35 weeks, emotional intensity can increase unexpectedly. You may cry more easily, feel impatient, or become anxious over situations that normally wouldn't have. This is not a personality shift. It is a hormonal surge. Estrogen and progesterone levels are at some of their highest in pregnancy. Your blood volume has increased dramatically to support uterine and placental circulation. That increased circulation creates sensations of heart pounding or palpitation. Sometimes you may even see your pulse visibly in your abdomen. This is circulation working efficiently, not cardiac failure. Anxiety often intensifies as birth approaches. The unknown creates anticipation, and anticipation can amplify fear. Many women report thinking more about what-if scenarios. Information and preparation are the antidotes to those spiraling thoughts. When you notice your heart racing or your chest feeling tight, pause intentionally. Stretch your arms upward, rotate your shoulders, gently lengthen your spine. Bring your awareness to your breathing. Inhale slowly, exhale slowly. Physiology responds to breath. Deep breathing activates the parasympathetic nervous system. This system reduces heart rate, lowers cortisol, and decreases physical tension. Even 2 minutes of intentional breathing can shift your stress response. You are not powerless over anxiety. Sometimes problems feel bigger at night. Fatigue reduces emotional resilience. Concerns that seem overwhelming at midnight may feel manageable the next morning. Rest changes perspective. It is okay to step away from unresolved issues temporarily. Pregnancy is not illness, but it is intense physical work. Your body is allocating energy toward preparing for birth. Mental rest is as important as physical. If your thoughts feel repetitive or intrusive, writing them down can help. Putting worries on paper externalizes. Often, solutions appear simpler when viewed objectively. Clarity emerges when chaos is organized. If palpitations are accompanied by dizziness, fainting, or chest pain, medical evaluation is important. However, isolated episodes of racing heart without other symptoms are usually benign in late pregnancy. Context matters. Your provider can always offer reassurance. Emotional waves do not mean you are unstable. They mean your body and brain are adjusting to imminent transition. You are preparing to meet your baby. Intensity at this stage is not weakness, it is anticipation. At 35 weeks, rib discomfort becomes increasing. Your baby has grown significantly, and the uterus now occupies most of the abdominal cavity. As space becomes limited, upward pressure against the diaphragm and rib cage intensifies. That sharp or persistent pressure beneath your ribs is mechanical, not dangerous. It reflects growth and spatial adjustment. Your baby's feet may press directly into the spaces between your ribs. Because the uterine wall is thinner now, movements feel stronger and more defined. What once felt like soft flutters now feels like firm pushes. This is a sign of muscular development and coordination. The diaphragm, which supports breathing, is slightly compressed upward. This can create the sensation of shallow breathing or chest tightening. However, oxygen exchange remains efficient in healthy pregnancy. Your body adapts automatically to maintain oxygen. If your baby begins to descend into the pelvis, you may notice relief in rib pressure. This shift often improves breathing and reduces reflux. That lowering sensation is part of preparation for birth. Your baby is repositioning, not slow, controlled breathing can ease rib discomfort. Inhaling deeply through the nose and exhaling slowly through the mouth relaxes intercostal muscle. Muscle relaxation reduces compression. Breathing is both mechanical and therapeutic. Gentle massage along the rib margins may also bring relief. Using warm compresses can relax surrounding muscle. Avoid strong pressure. Focus on comfort. Small interventions can significantly improve daily function. Posture matters more now than ever. Leaning backward excessively increases rib strength. Maintaining neutral spine alignment distributes weight more evenly. Supportive chairs and pillows are practical tools, not luxury. You may feel asymmetrical pressure depending on your baby's position. If the baby favors one side, discomfort may concentrate there. Position changes, such as lying on your opposites, may encourage slight reposition. Gravity influences comfort. Rib pain that is sharp and associated with severe headache or visual changes should be evaluated promptly. While rare, certain hypertensive conditions require monitoring. Context and accompanying symptoms matter. When in doubt, consult your provider. Most rib discomfort at 35 weeks is a sign that your baby is nearly full-term in size. Your body is housing a fully formed, growing human. Space limitation is temporary, growth is permanent. Around 35 to 37 weeks, your provider will recommend a group B streptococcus. This involves a simple vaginal and rectal. It may feel uncomfortable, but it is brief and important. This test is preventive, not reactive. Group B streptococcus is a common bacterium naturally present in some women. It does not usually cause symptoms in the mother. However, during vaginal delivery, it can be transmitted to the baby. Screening identifies who needs precautionary antibiotics. If the test is negative, no additional action. You simply keep the result in your maternity document. Hospitals often request proof upon admission. Preparation prevents repetition. If the test is positive, antibiotics are administered during labor. This significantly reduces the risk of neonatal infection. Treatment is effective and widely practiced. A positive result is manageable, not alarming. The purpose of antibiotics is not long-term. They are given during labor to prevent bacterial transmission. Timing matters more than duration. This protocol has saved countless newborns from complications. Some women feel anxious about the idea of bacteria. It is important to remember that colonization does not equal infection. Many healthy adults carry Group B strep without ever knowing. Screening allows proactive care. In addition to the swab, repeat blood work may be ordered at this stage. A complete blood count reassesses hemoglobin levels and infection markers. Other tests may reevaluate rubella, syphilis, HIV, hepatitis, thyroid function, and glucose. These are confirmation, not suspicion. Urine testing may also be repeated to rule out asymptomatic urinary infection. Even mild infections can influence labor if untreated. Detection ensures proper management before delivery. Safety comes from preparation. Bringing all laboratory results to the hospital streamlines your admission process. Clear documentation prevents delay. Organization reduces stress during labor. Preparation creates confidence. The 35-week testing phase is not about searching for problems. It is about ensuring everything is optimized. Prevention is a powerful form of protection. Information now creates safety later. At 35 weeks, repeating blood work is a standard and protective step. Many of the exams you completed early in pregnancy are reassessed now. This is not because something is suspected. It is because birth is approaching and confirmation matters. A complete blood count evaluates hemoglobin and hematocrit levels. Iron stores are especially important at this stage. Delivery involves blood loss, even in uncomplicated births. Knowing your levels allows your team to prepare appropriate. Infections screened earlier, such as syphilis, HIV, hepatitis, and rubella immunity, may be reviewed again. These are safety confirmation. Protocols exist to protect both mother and baby. Screening is a form of prevention. Thyroid function tests, such as TSH-T3 and T4, may also be reassessed. Thyroid balance influences metabolism, energy, and postpartum recovery. Monitoring ensures hormonal stability before delivery. Balanced systems support smoother recovery. Blood glucose levels may be reviewed if necessary. Even if gestational diabetes was not diagnosed earlier, late changes occur. Glucose regulation impacts fetal growth and labor management. Data guides safe decisions. If you are Rh negative, antibody screening may also be. This ensures compatibility between mother and baby's blood type. Preventive measures during pregnancy reduce. Medicine anticipate. It does not wait for complications. Urine testing can detect silent urinary tract infections. These infections sometimes have no symptoms. Untreated infections may influence labor time. Detection prevents escalation. Ultrasound assessments around 34 to 35 weeks evaluate fetal growth and amniotic fluid levels. Placental position and function may also be reviewed. These measurements help determine delivery planning. Clarity replaces uncertainty. Bring every exam result to your maternity admission. Having documentation avoids repetition and delays. Organization reduces stress when contraction. Preparation supports.com. These repeated exams are not about searching for danger. They are about ensuring readiness. Birth is a major physiological event. Preparation transforms it into a safer, more predictable experience. As labor approaches, fear often centers around the unknown. Stories from others can amplify anxiety, but every birth unfolds differently. Comparison is rarely helpful. Breaking your water does not always mean immediate delivery. Some women experience hours before active labor begins. The body transitions gradually. In most cases, urgency is less common than movies suggest. The first contractions are often irregular and manageable. Active labor develops progressively. Understanding stages of labor reduces unnecessary panic. Knowledge reduces fear. If you live far from a hospital, earlier departure during contractions is wise. If you live nearby, you may wait until contractions are closer together. Distance influences timing. Planning creates confidence. Block 5. Vaginal birth is often recommended because of benefits for mother and baby. Hormonal cascades during labor support newborn adaptation. However, safety is always the priority. Individual circumstances guide decisions. Cesarean birth can be life-saving. It is not a failure. It is a medical tool designed to protect healthy outcome. To find success. Pain relief options, including epidural analgesics, are valid choices. An epidural reduces pain while maintaining awareness. Some women choose natural labor, others choose medication. Both are legitimate. A birth plan can be a helpful communication. It outlines preferences, not rigid demands. Flexibility allows adaptation to medical reality. Dialogue builds trust. The most common fear about birth is lack of control. Preparation, education, and communication restore control. Understanding possibilities empowers decision-making. Confidence grows with information. There is no single correct birth story. There is only a safe birth for you and your baby. Healthy mother, healthy baby. That is the true measure of success. At 35 weeks, your baby measures approximately 45 centimeters and weighs around 2.6 kilograms. Growth in the final weeks is rapid. Weight gain reflects fat accumulation and organ maturation. Preparation for life outside the womb is nearly complete. Brown fat is developing under the skin. This special fat helps regulate body temperature after birth. Temperature control is one of the final systems to mature. Nature prepares in layers. Lung development is advanced. but still finishing. At 35 weeks, babies may breathe independently but sometimes need brief support. Each additional week strengthens respiratory stability. Time matters. Sucking and swallowing coordination improves significantly. Ultrasound may show your baby practice. Feeding readiness is a learned reflex. Practice begins before birth. If born now, feeding may require temporary support. Some babies need help latching. Colostrum in small amounts is sufficient initially. Stomach capacity at birth is tiny. Your baby recognizes your voice. Auditory memory begins in the womb. Familiar sounds create comfort after birth. Continue speaking and singing. Movements may feel different due to space limitation, while rolling decrease, stretching and pushing remain. If you notice no movement for several hours, stimulation and evaluation are important. Monitoring protects. Babies at 35 weeks are still considered preterm. At 37 weeks, they are classified as term. The difference of 2 weeks matters biologically. Every day supports maturity. Your baby's skin is smoother due to fat accumulation. The once translucent appearance becomes more opaque. Body proportions resemble a newborn. The transformation is nearly complete. You are carrying a nearly full-term human being. Your body has sustained this development flawlessly. The final adjustments are underway. You are closer than ever. Brain development accelerates dramatically in the final week. Omega-3 fatty acids contribute to neural growth. Sources include salmon, tuna, and other fatty fish. Nutrition directly supports cognition. Hydration becomes essential as uterine pressure affects digestion. Constipation is common due to slowed intestinal movement. Water softens stool and supports circulation. Simple habits create relief. Fiber from whole grains improves bowel regularity. Brown rice, whole wheat, oats, and vegetables support peristalsis. Dietary adjustments are effective and natural. Small changes create big comfort. There is no need to prepare nipples for breastfeeding. The Montgomery glands naturally lubricate and protect the areola. Avoid squeezing or manipulating them. The body prepares on its own. Correct latch is more important than nipple. Milk flow depends on areola stimulus. Even inverted nipples can breastfeed successfully. Technique matters more than anatomy. Colostrum is produced in small amounts at birth. The newborn stomach is the size of a cherry. Volume matches capacity. Scarcity is normal. Milk coming in often occurs within 24 to 72 hours. Cesarean births may slightly delay this process. Delay does not mean deficiency. Supply responds to stimulation. Rest influences milk production. Excessive stress can reduce letdown reflex. Protecting energy supports lactation. Maternity leave is functional, not recreational. Do not overcommit during maternity. Newborn care is a full-time physiological and emotional demand. Sleep cycles are fragmented. Recovery requires focus. Small daily choices. Hydration, nutrition, rest, breathing, accumulate. They support brain development, digestion, lactation, and recovery. Preparation is built through consistency. You are doing more than enough.